Hello everybody, and welcome back to the channel for this week's Toolbox safety topic video. Before we get started, make sure that you give me a thumbs up down below here to encourage me to make more videos of this type. Also, subscribe to my YouTube channel where you will find additional videos of this nature, along with other safety related videos and leadership training videos. Well, let's go ahead and get started. This is the second video in a 5-part series where we're talking about heat-related illnesses. The last video, number 1, we talked about the general heat-related illnesses and how to avoid them while on the job site. Today we'll be talking about heat exhaustion and heat stroke, the most serious of heat-related illnesses. Next week, video 3, we'll be talking about cramps and rashes. The 4th video, we'll be talking about nutrition and hydration and how important they are together in the prevention of heat-related illnesses. And then in the 5th and final video, we'll be doing some recap talking about how to prevent heat exhaustion, heat stroke, cramps and rashes, along with some symptoms and some first aid for those. But let's go ahead and get started with this week's topic, and it's heat exhaustion, heat stroke, symptoms, signs, and treatment. Okay, now heat exhaustion. Heat exhaustion is a condition whose symptoms may include heavy sweating and a rapid pulse, a result of your body overheating. It's one of 3 heat-related syndromes, with heat cramps being the mildest and heat stroke being the most severe. Causes of heat exhaustion include exposure to high temperatures, particularly when combined with high humidity and strenuous physical activity. Without prompt treatment, heat exhaustion can lead to heat stroke, which is a life-threatening condition. Fortunately, heat exhaustion is preventable. Now, here are some symptoms of heat exhaustion. Signs and symptoms of heat exhaustion may develop suddenly or over time, especially with prolonged periods of exercise or work. Possible heat exhaustion signs and symptoms include cool, moist skin with goosebumps when in the heat, heavy sweating, faintness, dizziness, fatigue, weak, rapid pulse, low blood pressure upon standing, muscle cramps, nausea, headache. And when is it time to see a doctor? If you think you're experiencing heat exhaustion, stop all activity and rest. Move to a cooler place. Drink cool water or sports drinks. Now contact your doctor if your signs or symptoms worsen or if they don't improve within 1 hour. If you are with someone showing signs of heat exhaustion, seek immediate medical attention if he or she becomes confused or agitated, loses consciousness, or is unable to drink. You will need immediate cooling and urgent medical attention if your core body temperature reaches 104 degrees Fahrenheit or 40 degrees Celsius or higher. Now, heat stroke is a whole different animal. Heat exhaustion allowed to progress will go into heat stroke. Now, heat stroke is a condition caused by your body overheating, and that's usually as a result of prolonged exposure to or physical exertion in high temperatures. This most serious form of heat injury, heat stroke, can occur if your body temperature rises to 104 degrees Fahrenheit or 40 degrees centigrade or higher. The condition is most common in the summer months. Now, heat stroke requires emergency treatment. Untreated heat stroke can quickly damage your brain, heart, kidneys, and muscles. The damage worsens the longer treatment is delayed, increasing your risk of serious complications or death. Some of the symptoms of heat stroke might include high body temperature, a core body temperature of 104 degrees Fahrenheit or 40 degrees centigrade or higher. And this is the main sign of a heat stroke. Altered mental state or behavior, confusion, agitation, slurred speech, irritability, delirium, seizures, and coma can result from heat stroke. Alteration in sweating. In heat stroke brought on by hot weather, your skin will feel dry and hot to the touch. However, in heat stroke brought on by strenuous exercise, your skin may feel dry or slightly moist. Nausea and vomiting. You may feel sick to your stomach or vomit. Your skin will be flushed and will turn red as your body temperature increases. Rapid breathing. Your breathing may become rapid and shallow. A racing heart rate. Your pulse may significantly increase because heat stresses places a tremendous burden on your heart to help cool your body. Headache. Your head may throb. Now, when do you see a doctor? If you think a person may be experiencing heat stroke, seek immediate medical help. Call 911 or your local emergency services number. Take immediate action to cool the overheated person while waiting for emergency treatment. Get the person into shade or indoors. Remove excess clothing. Cool the person with whatever means available. Put in a cool tub of water or a cool shower. Spray with a garden hose. Sponge with cool water or fan while misting with cool water. Or place ice packs or wet, cold towels on the person's head, neck, armpits, and groin. Now, some causes of heat stroke and heat exhaustion. Exposure to a hot environment. A heat stroke called non-exertional, which is classic heat stroke, being in a hot environment leads to a rise in the core body temperature. This type of heat stroke typically occurs after exposure to hot, humid weather, especially for prolonged periods. It occurs most often in older adults and in people with chronic illness. And then there's strenuous activity, which is called exertional heat stroke, and is caused by an increase in core body temperature brought on by intense physical activity in hot weather. Anyone exercising or working in hot weather can get exertional heat stroke, but it's most likely to occur if you're not used to high temperatures. In either type of heat stroke, your condition can be brought on by wearing excess clothing that prevents sweat from evaporating easily and cooling your body, drinking alcohol, which can affect your body's ability to regulate your temperature, becoming dehydrated by not drinking enough water to replenish fluids lost through sweating. And some of the risk factors for heat exhaustion and heat stroke. Anyone can develop heat stroke or heat exhaustion, but several factors increase your risk. Age. Your ability to cope with extreme heat depends on the strength of your central nervous system. In the very young, the central nervous system is not fully developed, and in adults over 65, the central nervous system begins to deteriorate, which makes your body less able to cope with changes in body temperature. Both age groups usually have difficulty remaining hydrated, which also increases risk. Exertion in hot weather. Military training and participating in sports such as football or long-distance running or working in hot weather are among the situations that can lead to heat stroke. Sudden exposure to hot weather. You may be more susceptible to heat-related illnesses if you're exposed to a sudden increase in temperature, such as during an early summer heat wave, or travel to a hotter climate. Limit activity for several days to allow yourself to acclimate to the change. However, you still may have an increased risk of heat stroke until you've experienced several weeks of higher temperatures. Lack of air conditioning. Now, in the field, we can't always have air conditioning, and fans may make you feel better, but during sustained hot weather, air conditioning is the most effective way to cool down in lower humidity. Also, certain medications. Some medications affect your body's ability to stay hydrated and respond to heat. Be especially careful in hot weather if you take medications that narrow your blood vessels, called vasoconstrictors. Regulate your blood pressure by blocking adrenaline, that's beta blockers, or rid your body of sodium and water, those are diuretics, or reduce psychiatric symptoms such as antidepressants or antipsychotics. Stimulants for attention deficit hyperactivity disorder, ADHD, and illegal stimulants such as amphetamines and cocaine also make you more vulnerable to heat stroke. Also, certain health conditions. Certain chronic illnesses such as heart or lung disease might increase your risk of heat stroke or heat exhaustion. So being obese, being sedentary, and having a history of previous heat-related illnesses. Now, there's some complications. Heat stroke can result in a number of complications depending on how long your body temperature is high. Severe complications include vital organ damage. Without a quick response to lower body temperatures, heat stroke or heat exhaustion can cause your brain or other vital organs to swell, possibly resulting in permanent damage. And then there's death. Without prompt and adequate treatment, heat stroke can be fatal. Now, some preventative measures. Now, heat stroke and heat exhaustion is predictable and preventable. Take these steps to prevent heat stroke or heat exhaustion during hot weather. Wear loose-fitting, lightweight clothing. Wearing excess clothing or clothing that fits tightly won't allow your body to cool properly. Protect your skin against sunburn. Sunburn affects your body's ability to cool itself, so protect yourself outdoors with a wide-brimmed hat, and they have those that go over the hard hat, and sunglasses, and use broad spectrum sunscreen with an SPF of at least 15. Apply sunscreen generously and reapply every 2 hours, or more often if you're swimming or sweating. Drink plenty of fluids. Staying hydrated will help your body sweat and maintain a normal body temperature. Take extra precautions with certain medications. Be on the lookout for heat-related problems if you take medications that can affect your body's ability to stay hydrated and dissipate heat. Also, never leave anyone in a parked car. This is a common cause of heat-related deaths in children. When parked in the sun, the temperature in your car can rise 20 degrees Fahrenheit in less than 10 minutes. It's not safe to leave a person in a parked car in warm or hot weather, even if the windows are cracked or the car is in the shade. When your car is parked, keep it locked to prevent children from getting inside. And take it easy during the hottest part of the day. If you can't avoid strenuous activity in hot weather, drink fluids, rest frequently in a cool spot, and try to schedule work or exercise or physical labor for cooler parts of the day, such as early morning or evening. Make sure that you get acclimated. Limit time spent working or exercising in heat until you're conditioned to it. People who are not used to hot weather are especially susceptible to heat-related illness. It can take several weeks for your body to adjust to hot weather. Be cautious if you're at increased risk. If you take medications or have conditions that increase your risk of heat-related problems, avoid the heat and act quickly if you notice symptoms of overheating. If you participate in a strenuous sporting event or working in hot weather, make sure there are medical services available in case of a heat-related emergency. Well, that's a lot. Heat exhaustion and heat stroke are dangerous things. Learn these symptoms. Keep an eye out with your coworkers. Protect them, protect yourself. If you experience symptoms, take actions immediately to cool yourself or your coworker. All right, boys and girls, that's it for this week's Toolbox safety topic video. Thanks for watching. Thanks for stopping by. Make sure to turn into the other videos in this series. Make sure you give me a thumbs up down below here to encourage me to make more videos of this type. Also, subscribe to my YouTube channel where you will find additional videos of this nature, other safety-related videos, and leadership training videos. And until we see each other again, take care of yourself because you're number one. Look out for your coworkers and help ensure their safety. Have a grateful day, and remember, I will see you in the field.